difference between capitalism and crony capitalism, which is kind of turning capitalism on its head. But we can't. The private sector still failed in many ways too in the COVID situation, because COVID test result delays are primarily a private sector failing, with Quest Diagnostics and LabCorp being the testing facilities responsible. Multiple players and fragmentation in the private sector exacerbated administrative burdens and costs. How do these facts, jive with your narrative on private sector strength in handling America's healthcare crisis? Can the private sector, without government help, actually handle this when they couldn't even get the testing right?
Right. But when we say that the private sector failed to handle it, what do we mean by private sector? We certainly don't mean a free market sector, because that's not what we have. Even the private sector still has to jump through hoops. They have to wait for the FDA to approve things. It slows down the process. We saw at the very beginning, they weren't able to adequately start developing the testing. There was a lot of give and take over who could have the tests, what kind of tests were appropriate, how they could administer them, and they went back and forth, and that really slowed down the process and the rollout. And so even though it might be private companies responsible for it, they still have regulations that are hindering their ability to fully expand and address the needs of the market. So I think that when we're talking about what would a private system look like, we have to remember we haven't had a private system in this country for at least 100 years. We've had a system that is overly run by government, and even when you have private actors trying to do their best, they constantly have to jump through these hoops. And again, I think we have to go back to one of the most important things when it comes to our healthcare system, which is that government is intervening into the healthcare market for its friends. It is not doing this willy-nilly. It's doing it for people who come in and pay a lot of money. They lobby their friends in government because they want to protect their interests. They want to block competition. They want to ensure that they make the most money and that they're the only option in the game. And it works. In New York City, they had an overflow hospital that saw only 79 patients. They spent over $50 million and counting on this overflow center for 79 patients. And one of the reasons they couldn't see more patients was that ambulances, companies there, had special contracts with government hospitals to where they had to take patients to the overflowing hospitals, even though the sitting beds were right there at the overflow hospitals. That's the kind of cronyism you get under government, where they are patting the pockets of a few selected companies. And so it's to the disadvantage of all of us.